Well, there's a number of things that they need to consider, especially if they're at the 50 employees or more. It's a very real concern, and for a lot of these business owners that I've talked to, I've told them your best friend today is your insurance broker, and that's because these guys, they're out there running their business, doing their thing that they know how to do. They don't have time to sit down and try to figure all of this out, and so that's what we do as consultants and brokers.
Right.
For health insurance.
Because I know a lot of small business owners, we'll focus on large businesses in a moment. A lot of small business owners, they're just confused. They don't know what they need to do. So assuming that there is no 1-year delay on the individual mandate, let's say I own Matt's rug shampooing service and I've got 7 people working for me. What do I have to do?
Yeah. Well, as a small business owner, under 50, you're actually in pretty good shape. The mandates really aren't going to apply to you when this comes in 2015. So as far as the under 50 goes, there's not a whole lot that you really got to worry about. There was a letter that was supposed to come out October 1st, and that letter is still out there. It's just basically a notification of the healthcare reform exchanges that are opening October 1st. That letter, September 11th, they passed a law that said it is no longer required. However, it is considered prudent to still distribute that letter. So
this is a letter of notice then?
It is, okay. Right. And so regardless of the size of your company, whether you offer benefits or not, you're going to be required to send that letter out. That is no longer required.
Okay, that's good. One less piece of paper. Now, let me ask you this. Sure. In my business with my 7 employees, if I presently offer them health insurance, I've got 2 options, right, Derek? I can stop offering them health insurance and let them go to the exchange, or I, as the small business owner, will be able to use the exchange to help them get insurance and get myself a tax credit as the small business owner, correct?
That's correct. There's what's called the shop, and there are a lot of factors that go into the shop exchange, but depending on the size of your company, average wages, things like that, there would be some exchange credits that are available, and that's something you definitely want to get with your broker or consultant about to try to figure those out. It's sort of a complicated formula, but for a lot of small businesses, there would be the shop available for things like that.
Do you think a lot of small business owners are going to stop giving their employees health care coverage and just let them go to the exchange? Do you think we're going to see a lot of that?
At this point, a lot of the companies that I've talked to, health insurance is one of those benefits that they use to recruit good talent. And so I haven't seen that. Now, that's not to say that in the future they wouldn't trend that direction. But as of today, the companies and business owners that I'm talking to would like to go ahead and still maintain that coverage.
And what about the possible trend of devising a new package that covers it without covering it, so that they're out of the insurance business and they're small business and yet still staying compliant with everything?
You talking about the defined contributions, basically giving them
yes,
money? Yeah, that's something that is a lot of people are talking about. There's some questions as far as COBRA laws, ERISA, things like that, whether you can do that or not.
Right.
It is something that people are considering. I've had a lot of questions about. We're looking into, and so we'll see. I mean, that's in today's world. It's not a big factor, but it is something that I see on the horizon. I've told a lot of my business owners, to keep an eye on something like that, potentially just to basically predict costs better and still provide the benefits to their employees. So.
All right, 742, Derek Babcock with Next Level Solutions with us. Their website is nextlevelsol.net. All right, let's talk about businesses that have more than 50 employees. They absolutely have to start doing a lot of work, don't they?
They do, and I've got a lot of companies who are looking at breaching that 50 mark, and I've told them, I said, look, I always encourage you to grow your business, but it is a new world once we do. And that's not a bad thing. It's just that we've got to consider things a little bit differently, and health insurance primarily. If they when this thing first came out, a lot of companies said, "Well, it's cheaper for me just to drop benefits and pay the penalty, the $2,000 per employee." And actually, a lot of the scenarios that we have run, we have not found that to be the case. It has been still more cost effective for the employer to provide the health insurance benefits.
Can you clarify one thing for me, Derek?
Yeah.
I understand that it's $2,500 fine per employee if you don't provide them health insurance, correct?
If
Is
you
that
don't
right?
provide them, it's $2,000 per employee. It's basically, if you cross that 50, then they are going to subtract the first 30 and charge you $2,000 per employee.
That was
after
my question.
if you
Why
do
the
not.
first? Why the first 30? You get 30.
That, specifically, why they came up with 30, I don't know. But that's how they calculate this formula. They take the number of employees to over 50, subtract the first 30,
Okay.
multiply it times 2,000.
Now, one of the big questions that full-time employees, that companies larger than 50 people, one of the big questions they have, Derek, is, okay, what constitutes a full-time employee? Can you take us through the new rules on what constitutes a full-time worker?
I can do that. So a full-time worker is any employee who works 30 hours or more per week. But you have another factor that comes into that, and that is full-time equivalents when they're calculating the 50. And so that may be a part-time employee that's working 25 hours per week, but they're going to take all of your part-time hours, add those up for each month individually, and then divide that by 120.
Oh, Lord.
And so now those employees, they may count towards your what they call ALE, which is an accrued large employer, meaning you must provide benefits, but you don't necessarily have to provide benefits to those employees that are under 30. So they may put you over that line, but you don't have to provide benefits for those. So I'll tell you, one of the main conversations that I've had with a lot of employers, and this has subsided since they decided to delay this mandate, but is how do I control my costs? How do I cut back hours? How do I cut back the number of half? And so, that was a real concern, and I know there was a lot of talk in the media, but real life conversations that I have had with business owners has been exactly that. How do I control my costs? And that's by cutting hours, cutting employees.
Yeah. Complex. Derek Babcock. Derek, we're out of time, but listen, thank you. Derek is a healthcare consultant, executive consultant with Next Level Solutions. The website is nextlevelsol.net or 279-7564. You've had your head way deep into the books on this, and we appreciate your expertise, okay?
Thank you, Matt.